My name is 16.Tarinelli. This is my lovely wife, Rita Tarinelli. We've been health coaches for how long, hon?
11 years.
11 years and counting. And tonight's presentation is going to focus on the health professional market and why there's so many benefits for health professionals to take a look at Take Shape for Life and how it can help their patients and also help their practice. There's three powerful components that are part of our program: the 5-in-1 structured eating plan, the Habits of Health lifestyle system, and the personal support of a coach, a free health coach, to provide the guidance and support. We're going to hear from three really great speakers tonight, health professionals involved with Take Shape for Life that have been using our program successfully. Now, our first guest is Dr. Lance Simpkins, and Dr. Simpkins is a cardiologist with 5 board certifications, including interventional cardiology and also obesity medicine. So, Lance, looking forward to hearing from you and talking a little bit about your Take Shape for Life experience. We have a couple of questions for you. Lance, are you there?
I am here. I am here. Can you hear me?
Oh, wonderful, wonderful. All right, and can see you fine, Lance.
Yeah.
Great. Hi. How are you?
We're doing great, Lance. We're looking forward to...
Thanks for having me, Dominic. Rita, appreciate it.
Our pleasure, our pleasure. First question I wanted to ask you, Dr. Simpkins, is what attracted you to Take Shape for Life?
So I've been in practice for almost 25 years now. And always in my career, I've been very much attuned to prevention and lifestyle and really, getting my patients to do the right things, but had not had great success. Really, I kind of stumbled into this personally. I've always tried to keep myself healthy. My dad was obese, and he actually wound up dying young at 62. But I never was heavy. But 4 years ago, I was playing racquetball with my kids and tore my knee and had a little surgery and put on a little weight. I got frustrated. Won't give you the long story, but I put on 8 pounds, and it bugged me because I had to buy bigger pants, and Dr. Simpkins doesn't buy bigger pants. So it was uncomfortable. I bumped into a family practice buddy of mine who was doing Take Shape for Life with his patients and had had success, and grudgingly decided to do it myself, and actually lost the 8 pounds and loved the way I felt so much better that I kept on the system of small frequent meals and wound up losing 30 pounds and got back to my high school weight for the first time in 35 years. So to me, it was a gift. I literally have felt 10 years younger, and I've kept that off for 4 years now. So the reason I bring that up is because over my career, I did not have great success with my patients. And it just seemed like a no-brainer. There was no way I could not share this with my patients. So I started coaching my patients in the practice and really having success where I never did before. And my employees started noticing that real people, not just crazy Dr. Simpkins, but real people were getting healthier. My employees started doing this. They invited me to the hospital to do hospital challenges with the employees who do struggle, and actually asked me to be the chief wellness officer at my open heart facility. So I've continued to grow and expand in my knowledge of the program, and I just love the power of the program and what it does.
Awesome. Okay, so we have that's really great. We have another question for you. So there are many employed physicians today across the United States. Does that mean that they can't participate in Take Shape for Life?
So employment is a great big giant statement. There's so many probable varieties of types of employment. So I work for a little healthcare company. Some of you might be familiar with Tenet Healthcare, number 2 in the United States. And honestly, when I first joined Tenet, I was already doing Take Shape for Life, and I told them about it. And they said, well, that's fine. You can certainly do this on your own outside of the practice, and then we'll take a look at it and see if it's something that we can incorporate. I will tell you, with big companies, it's never a simple matter, but after 6 months of going up their corporate chain through compliance and legal, they absolutely came back and said, this is clean, this is good, we encourage you, go ahead and do it. And now they've loved it, and they've seen what I've created. As they mentioned, I went on to learn about the possibility of becoming board certified in obesity medicine, and loved the training. I jumped at the chance to do that. And now I am definitely recognized in my area as somebody who really knows what to do. And this is still my favorite approach towards obesity management. But my employers have embraced this. Again, everybody's situation is different, but there's nothing to prevent somebody from going down that avenue to look at that, or to do it outside of their practice if their employer doesn't want them to do it inside.
Perfect. Excellent. Lance, any other thoughts that you want to share with us before we move on to our next speaker?
I think that what I would say is that it's been a great experience. I love what it's done for the health of my patients. It actually has predicted income outside of managed care. It's great. That's a whole nother discussion, but I get a check at the end of the month, and it goes straight through to the practice and into my productivity, and it's easy and it's clean, and it just works very nicely in the practice. It's a win-win.
And Lance, Dr. Simpkins, you want to share a little bit about maybe the first part of Take Shape for Life, which is that structured eating part, and why it makes so much sense, and how have you seen the patients receive that part of the program?
Yeah, so the structured eating plan, for those of you who may not be familiar with what it is, it's small, frequent meals, and we've all been hearing this for years of the importance of small, frequent meals. But most of us and most of our patients are just too busy to do it, and it's not easy, and this just structures that. So my experience eating small portion-controlled meal replacements 5 times a day in one healthy meal, people get to a healthy weight very quickly. But my universal experience, Dominic, is that people feel more energy by the end of the first week on this program, even as they're starting to quickly lose weight. And that has been a almost universal feedback from patients. They feel good, they're excited, they're motivated. It is truly what I think of as a teachable moment to really get them on track. And then the system incorporates a habit of health system, which is a complete behavior modification program, which is amazing and completely comprehensive, and teaches my patients things that I don't have time to teach them personally. So it's really the structure of the program that makes it so powerful. Great.
Well, Dr. Simpkins, thank you for sharing your thoughts on this Zoom presentation tonight, this live video conference. And, it's exciting to partner with someone with the credentials that you have. I think it elevates everything about Take Shape for Life when somebody with 5 board certifications and certified in obesity medicine is really on board and really is excited about the Take Shape for Life program. So thank you very much.
Thank you.
Our next guest speaker is a good friend of ours. We've known Dr. Dan Van Zandt for a long time. He's been involved with Take Shape for Life for over 8 years. And, we have a question. Dr. Dan, are you up and running? See you on the screen and unmuted. And we'd like to get a chance to hear a little bit about your perspective of Take Shape for Life.
Happy to share, Don. Can you hear me?
Absolutely. Can hear and see you very well, Dan. So, Dr. Dan, one of the questions that I have for you is someone that didn't have a personal weight loss story, because I know when I met you, you were very fit. You were, and you may say that you weren't as in good a shape, but your out of shape is really like in shape for every other American. So you've always kept such a high level of fitness. So not having a personal weight loss story to share, did that cause any challenges? Did that slow down the progress of you sharing this program with your patients?
That's actually a great question, Dom. And my experience was, since I really didn't have a weight loss experience, I had a small one, but my passion was helping patients, get healthy. And I was talking to my patients about, getting healthy and losing weight and changing their lifestyle for over 11 years. So, I was desperately looking for something like this, and my patients and community knew that I was passionate about helping people get healthy. So, similar to Dr. Simkins, about 8 years ago, I was introduced to Take Shape for Life, and just about a year prior to that, some major changes happened, in the insurance company, and I was spending more time in the office and had, less time to take care of myself. And 8 pounds for me was like Dr. Simpkins. That was just absolutely, unacceptable. And I saw the writing on the wall that things, were to continue the way that they did, that my weight was going to continue to get out of control. So, before I, started something, in the office, I really wanted to be, have a visceral experience. I really feel that's important before I start recommending something to my patients. So I went on the program and shaved off that 8 pounds in just a couple weeks. And for me, that was the experience that I feel I really needed to look somebody in the eye to say, listen, this program works. It'll work for you, and I'll help you. And, you can really relate to people going through those first couple of weeks, which is really the most important to get them, in momentum on the program.
And I remember you had some family members, I believe your aunt and a few other patients, that really became almost like your testimonials, your billboard, so to speak, within your practice. You want to touch base a little bit on that, on how helping others lose weight then actually it creates this momentum inside your practice?
Yeah, happy to. I mean, I remember back then, Dom, me really not having much of a weight loss story, but you and Rita did. And I started with your stories, and who better to start with someone that had, you guys have lost, I think about 90 pounds together, and at that time had kept it off for, I don't know, 6 or 7 years. So I started with your story. And then, my first couple patients did, beautifully on the program. And then my aunt, who, the doctors gave up on,
Wow.
did so beautifully. So like you said, I leveraged your experiences and some of your clients. And then as I enrolled more and more clients and my aunt, that personal story was so close to me that I could now say, after just, a month, that I had a handful of my own clients, on the program. But I started with the people on my support team and then my first few patients.
Awesome. That's great. So, as a busy chiropractor running a private practice and all the challenges that go along with that, how did the income generated from Take Shape for Life impact the practice?
It impacted it quite significantly. With the insurance changes, my income dropped 20% overnight. So that was a huge, huge hit, a huge stressor. It became more about a little bit more about numbers, and that was very disheartening. So within about 3 months, I had enrolled about 30 to 35 patients on the program, and that basically neutralized, my overhead. So that took a lot of stress off, and it also added a great value, to my clients and into the practice, a great vibe in the community. But it really helped take some stress off and allowed me to really practice the way I wanted to, instead of really just trying to, meet the numbers every month.
Wonderful, wonderful. Now, I know that, Dr. Simpkins, he talked about the structured eating part of this program, which provides that predictable transformation. It's goof-proof. People do the 5-in-1 plan, they're going to lose weight. But it's also important to keep it off. And I know that this is something that you have a lot of passion in. That's the whole lifestyle system that really makes a difference and kind of separates Take Shape for Life from all the other diets or programs or meal replacements of any kind out there. Share a little bit about that process in the lifestyle system.
Sure, and you really hit the nail on the head, Dom. This is what really separates us from all the other programs. And I just pulled a little pamphlet out here. And, it really just talks about, the 6 steps in Take Shape for Life, preparing for your journey, reaching a healthy weight. And then there's 4 steps beyond that. So, where other programs stop, that's where really the meat and potatoes of Take Shape for Life starts. It's all about transitioning to healthy eating, learning healthy habits, optimizing your health for your age, and really, really helping people focus on creating health instead of just reaching a number on a scale. Because just because you're at a healthy weight doesn't mean you're healthy, right? There's people that have cancer and smokers, and so it's really focused on optimal health. And the thing that I really liked about the Habit to Health system is Dr. Anderson, is a smart guy, and he went to the National Weight Control Registry, and he just interviewed the 5% of people that have lost at least 60 pounds and kept the weight off for at least 5 years. How did they manage to maintain their weight after they went on whatever program they did to lose the weight? What behavior and lifestyle changes did they make to help them manage their weight through all the ups and downs that life throws at you. So with all that information and some top-level research that he did on his own, he created the Habits of Health system. It's an amazing book set, and this is what, for the people that really plug in the textbook and the workbook. This is the information. This is based on the people that have been there, done that, and that's what really attracted me to this. Is it had that second piece that really no other program does.
Great. And Dan, long term, tell us some of the patients that you've helped 8 years ago. It's pretty exciting to see those people who have adopted those habits of health and are also staying healthy, correct?
It is. It's amazing. Another thing that just kind of touching on, what, being, in practice, as a, being a sole practitioner, just a, an office manager and one receptionist, as the doctor, we tend to try to wear the hats of, a chiropractor, a nutritionist, a behavioral therapist, et cetera. And I'm not certified in those, areas, and I was given the best recommendations that I could, but the lifestyle recommendations that I was giving to my patients, that I was doing all my life to stay at a healthy weight, that wasn't a strategy to lose weight. That was a strategy to maybe, maintain the weight they're at, but the majority of my patients needed to lose weight. So this was a great structured system like Dr. Lance talked about, but more importantly, the system is designed, the structure of the system is designed to where Take Shape for Life has registered dietitians, behavior therapists, et cetera. So I could plug my clients and patients into a support system, and I didn't have to be those other pieces. That system was designed to be their support system, and I could just be their guide, their mentor, their coach. And that took a huge weight off my shoulders, knowing that I was going to be able to plug people into a system with licensed specialists, where I was just trying to do the best I could, within those areas.
And that's pretty amazing that this all comes along with a very, very small investment. Actually, a dinner and a movie costs more than it does to get involved in Take Shape for Life as a health professional. So it's not even about the investment; it's about what it produces. It's about the benefits of the practice, and of course the patients. And that's why you guys are in practice. Is that you became doctors because you want to help people. And Take Shape for Life has this broad spectrum. It has things to offer for cardiologists and primary care doctors, nurse practitioners, chiropractors, dietitians, nutritionists, anybody that has a patient base that needs to get healthy. We can offer that help for them. So Dan, I want to thank you very much for sharing your insights and thoughts here in your experiences of Take Shape for Life, and look forward to seeing you soon.
Absolutely, Don. Just 10 more seconds. When the founder and the director of John Topman's Weight Control Center endorses the Habits of Health system as the most comprehensive one out there, I think that speaks volumes.
Absolutely. Thank you, Dan.
You're welcome.
Our next speaker is Dr. Mark Nelson. Dr. Nelson, are you there? And I know you're there on the presentation. Just wanted to get you unmuted and get a chance to see you. So, Dr. Nelson, I have a couple of questions I'd like to share with you.
All right, wonderful. Dominic and Rita and everyone else, thank you for allowing me to share this on this webinar.
Well, Dr. Nelson, you've been involved with Take Shape for Life now for over 8 years. You're a cardiologist, an interventional cardiologist, and we were very excited to be able to partner with you 8 years ago to help you get this up and running in your practice. And so a question for you, Dr. Nelson, is that I know you were trying to help your patients lose weight for years. I know that was a passion that you always had. And when you started using Take Shape for Life in your practice, what were the results that you started to see as far as your patients' health?
Let me answer that. Just one minor correction. When I was practicing full time, it was as a non-invasive cardiologist.
Thank you for that. All right.
Dr. Simpkins is an interventionalist, and I'm the other part of cardiology. But the more important point is that I had struggled for many years because I realized that the root cause of most of the diseases that I was seeing was overwhelmingly due to overweight and obesity. now to some degree smoking. But actually, that was a problem that was growing less, thankfully, due to the years of public health campaigns and the rest of it. While the overweight and obesity epidemic was rising in America and in my patients, and my patients were getting bigger and bigger with more severe diseases, I was writing more and more prescriptions. And when I found Take Shape for Life, which for me was a very science-based and medically based program, I grabbed a hold of it. And the results were simply astounding. For the first time in my career, I could consistently and predictably help people who, as a result of safe, rapid weight loss, saw a dramatic improvement or complete resolution in many diseases such as type 2 diabetes, metabolic syndrome, hypertension, hyperlipidemia, non-alcoholic fatty liver disease, sleep apnea, with improvement in many signs and symptoms. I saw blood work improve, vast improvements in lipid profiles, fasting blood sugars, hemoglobin A1C, C-reactive protein, and other inflammatory markers. Most of all, my patients were becoming healthier and happier with fewer medications. Many were getting off of antidepressants. They got their lives back, they got their health back, and most of all, they got their minds back. They had minds that were unhealthy, that were addicted to the notion that they really would never be able to be healthier and have more energy and confidence. And quite frankly, Take Shape for Life, when I learned how to drive that very powerful vehicle, which is very simple, was really responsible for dramatic changes in their health and well-being.
Wonderful, wonderful.
That's
so I know
great.
Rita has a question for you.
So yeah, so one of the most successful health professionals in Take Shape for Life, can you give us some suggestions and success tips that can, share with some of our HPs that are watching this presentation?
Sure. I was wondering if it would be okay if I also comment on some of the questions that people had at Pri-Med and that I encountered as a cardiologist in terms of issues sometimes people raise, so newcomers on the call can understand really how good this program is. Rita, I do want to answer your question. So one of the questions obviously is affordability. Our meal replacements cost no more than regular food. 1 month of meal replacements at most is $12 a day. People simply redirect their food dollar from the supermarket to the program. Another question patients had is it hard to do the program? And what they learn is the meals are simple, easy to prepare, many on-the-go meals for people who are busy. We don't have complicated regimens. There's no calorie counting. There's no weekly meetings and weigh-ins. The program is simple and easy for people to do. And while they're doing it, they're learning a core habit of health, which is eating every 2.5 to 3 hours, frequent, small, healthy meals. Now and then I get a question about processed food, and these meals are processed, but it's not the processed food most of us are suffering with, meaning most of the processed foods in America are obesogenic. Why is that? Well, they're loaded with calories, sugar, fat, and salt, and these meals are not. These are healthy processed foods with nutrients, vitamins, and minerals, adequate protein, fiber, 24 vitamins and minerals. Yogurt is also a processed food, so I think people began to understand that the term processed food doesn't tell you in and of itself if a food is healthy or not. It simply tells you that it didn't come straight out of the ground or off a tree. Does the food taste good? We have over 75 varieties of portion-controlled meal replacements. And my patients were thrilled because when they learned the nutritional footprint of these meal replacements was virtually identical, they could pick and choose whatever meals they want, from soups to chili to beef stew to cappuccino to bars to pancakes, whatever someone wanted. The other question I think that's very important, and the other speakers commented on this, was the concern that people would regain their weight. And what's terribly important to understand is doing the 5-in-1 program, people are learning new eating habits for the rest of their life, specifically eating small, frequent, healthy meals, which is really a key principle, whether one is using meal replacements or not, to losing and maintaining one's weight. But most of all, they develop a healthy mindset with really understanding that food is fuel rather than being focused on food all day. And we also, of course, have a weight maintenance program with tools and support for people. So when my patients learned that, they had much more confidence and comfort understanding that this wasn't a diet. This was just not simply about losing weight. It was really about a healthy mindset with tools and resources to help people and guide people from the beginning on, and forever, quite frankly, because those changes become internalized as new habits.
Wonderful, wonderful.
Awesome.
So, maybe a little bit of comment, Mark, on when somebody gets started with Take Shape for Life, like Advita had mentioned, maybe what are the common, I guess, the do's and don'ts? There's things that you can do that will enhance the success of the program. And there's a few things that actually are not, that if you do it, you probably it's not going to work very well in your practice. And maybe you wrap up a little bit with some of those kind of do's and don'ts, so to speak, in the practice.
Sure. I mean, I think the most important thing to understand is that our program and business are predictable if we work with our mentor. It's just like mentoring in medicine. I had doctors and teachers who taught and guided me. Well, we have the same structure in Take Shape for Life, which means that for anyone on the call who's interested in thinking about becoming a coach, you have support. Now, where does it start? Well, it starts with you. It started with me. And Dominic, I don't know if you remember this, but a few months before I met you, I weighed 195 pounds. I was the cardiologist telling people to get healthy. Now I'm 5'11". I felt terrible. I looked terrible. I lost 15 pounds on my own. It was extremely difficult, mostly for Margaret, because for her to prepare those meals for me took a great deal of effort. I, believe me, did not take that for granted. The rest of the 15 pounds I lost, some right away with Take Shape for Life, as you know, and then later I lost another 5. So I now weigh 165 pounds, and I've been around that weight now for, close to 6 to 7 years. Now that's very important, because when we are role models, if we are willing to walk the walk and talk the talk and be congruent and practice what we preach, we're now in a very powerful position to be believable. Being believable is essential, because we are about the real deal. We are about people being healthy, including all of us. And so for me, my health was extremely important, because now I could say to my patients, I found something that works, and they could see it and believe it. And my working with my coach was really important, because they were my accountability partner. So for people who are new to Take Shape for Life, your health coach, your business coach is there to help you and support you and guide you and help you and members of your staff, because when your staff is engaged, and many of them will want to become healthy as well, now your practice becomes a center of wellness. And you can now generate wellness and bring a wellness component to complement the rest of the practice that most of us have as treating and reacting to disease. So that's the first principle. I think the second is to ensure success of your program, to work with your business coach. Because as a new health coach, if you choose to do this, you and your practice have consistent professional support and guidance from your business coach. Our role is to walk with you, teaching you and your staff the program and the business, how to share it, how to enroll patients, how to coach them. We have all the tools and marketing materials that you need. One mistake is to try to do it alone or try to create everything you think you need yourself, because we actually have done all that. And that saves you a great deal. It's like building your own car. If you have the time and expertise to do that, that's fine. But the vehicle is already in place. So our role is to help train new coaches and your staff, appoint person who you select to administer the program, to work with that person and your staff to help you learn the basics. Again, how to share the program. That could be one-on-one. It could be in meetings, which many providers prefer. This is fun and easy to set up with our help. Our business is really turnkey. It is the antithesis of complicated. And I realize that may be hard to grasp because the life of most practitioners has gotten exceedingly complicated with, among other things, 68,000 ICD codes, which have nothing to do with what we do. Thankfully, that's a wonderful thing. I just want to touch on coaching because we talked about really the pillars of Take Shape for Life. Our tools, our meal replacements, which are really the catalyst for long-term change. Our habits of health system created by Dr. Anderson, who is in truth a visionary, and a health coach. And the thing about coaching that's so important is that it's simple, effective, and fun because we aren't teaching people complicated things. We are really guiding people on a path that's paved, that's simple, that's uncomplicated. Your patients have all the access they need to online support, a habits of health system program materials with a coach as a guide. That's why when I was practicing cardiology full time, I was able to support a whole lot of clients, and it never occurred to me I'd be able to do that. But as their guide and their accountability partner, they were doing the work. I wasn't doing the push-ups for them. They were doing the push-ups, but they had all the support and guidance that they needed to be successful with my encouragement and the rest of it. So the bottom line is coaching is easy, and the real power of this model, I think, for everyone is the knowledge that you're not on your own. You're part of a team that will help you and support you, help as many people as you choose to. And due to the fact that there are only 130 million Americans who are overweight or obese, we have a lot of work to do, and we obviously are looking for people who not only understand the gravity of this epidemic, but actually want to do something about it, which I believe everyone does. Well, we have a vehicle that can obviously help you do that.
Well, thank you very much, Dr. Nelson. That was great. We appreciate you sharing your thoughts, your insights, your experiences, and as well, a person in Take Shape for Life, a cardiologist that has been extremely successful, sage advice and wisdom. So I want to encourage everybody to get back to the person who invited you to this presentation. I'm sure you're going to have questions, and that's good. Questions are good. And the person who invited you are experienced in this. They'll be able to handle it. And, you know, whatever participation level you want to take advantage of, whether right now it's either referring your patients to a certified coach or getting involved as a provider and becoming a coach, we're here to help. So I wanted to thank everybody here for participating, and I wanted to wish everybody a good night.
Good night.